Did I bypass all of this to get to train? Yes, I did. It's an anastomosis. It's a bypass. It is a great way for our heart to say, wow, we're not getting enough blood in this area. Send it around. Send it around the other way. Questions? It is super cool to see the look on your guys' face when I use I-5, 405, and 99 as an example. Because every single one of you have done it. You're like, yep, traffic's bad. You see the sign, okay, and it says I-5 done. And what do? Can you go even better than that? Yeah, you could go Rainier Valley if you needed to. Everybody's like, yeah. Through downtown, it might take some time, but still, it's always good to see the peeps downtown, right? The downtown Seattle freak show. That's always good. I love driving through Pike Market. Like, what the heck is that? Right? Yeah, isn't that a bypass from Highway 99? It is. Can we jump back on to 99? Yeah. Can we jump over to I-5? Yeah, it's an anastomosis. It's a way around. There are people that are nice in Seattle, don't get me wrong. But you guys know you stare just as much as I do when you get down into those neighborhoods, or those areas. Cardiac veins. Well, great cardiac vein, anterior cardiac vein, posterior cardiac vein, middle cardiac vein, small cardiac vein. Do they give away where they're at? They do. They do. And when we see the heart, you guys will be like, what? They made it that easy? I know. Craziness. Wow, there we go. There's your heart. Okay, there's your heart. We got the pulmonary trunk right up front there. Notice all of our vessels. Great cardiac vein, anterior interventricular, circumflex. What's the circumflex doing? Around. Yeah. Small. Notice our small one there. Okay, right coronary artery, atrial arteries. Well, atrium. Tells you where it's at. So actually, and I'm not going to say it's easy, but it helps. It helps a lot to know the terminology and the way to put it into perspective. Okay, so do I like this image? Yeah, I do. I do, because it's the coronary circulation. I like this image because it's coronary circulation. Okay, coronary, the heart. Pulmonary, the lungs. Systemic, the body. Good. One more time. Pulmonary. Systemic. Coronary. Okay, this is showing you another angle, how they meet up. Okay, this is directly connected to this. It's just showing you how they move around the heart to the posterior aspect. The posterior surface of the heart. Notice the circumflex coming around here and meeting up.
Is the circumflex kind of meet with the coronary sinus?
Well, let's back up. Great cardiac vein meets with the coronary sinus.
Oh,
See there? But circumflex arteries. So remember, arteries and veins. Arteries and veins. These are normal. Arteries, oxygenated. Veins, deoxygenated, because this is the supply to the heart. This is the supply to the heart, not to the lungs. Okay? That's scary. That's like haunting. Like you could see mold growing on that. That's scary. Okay, this is just showing the narrowing of the arteries, lipid deposits called plaque, Amina. How's that make you feel? You gonna go eat a big giant sandwich filled with yumminess and extra gooiness and like extra chippy chips with the deep fried for happiness for days and days and days? Oh, okay. Yeah, her comment to me yesterday, she saw a video on this and it kind of scared the daylights out of her. She's like, I'm gonna go home and eat carrots and exercise. Okay? Yeah. So normal artery, yeah, look at that. Happy camper. Lipid deposits of plaque, also known as cholesterol, right? Yeah, that looks fantastic. Whoa. So keep eating those fatty sandwich happinesses. That's what it'll do to you. Not with one sandwich. If you eat one hamburger or one chicken burger or whatever, that's not going to cause this. It's a life of doing this. If you go to Dick's Burgers, breakfast, lunch, and dinner, then yeah, this is occurring. Okay, but every now and then you can have a Dick's Burger and be happy about it. Okay, this is just heart disease, coronary artery disease. Okay, it's talking about plaque and buildup. It usually starts with simple symptoms like angina, chest pain. Angina, chest pain. Okay? It's a temporary ischemia that develops when you're working your heart too hard. If you have chest pain on this side, really, your heart's not on that side. Calm down. Okay? If you're like, oh, this hurts because I was moving my friend's house yesterday, you're not having a heart attack, you're safe. Okay? It just means your muscles are sore from picking stuff up. You can actually hurt these muscles, these pectoral muscles right here, okay, from working, doing stuff, helping your friend move. Myocardial infarction, it's a heart attack, MI. Okay, again, this is all heart disease. This is the kind of stuff, if you want to scare yourself, yeah. Risk factors, well, stop smoking, treat your high blood pressure, dietary modifications. I like that. Okay, for now on, instead of saying I'm going to change the way I eat, I'm going to say I'm going to make dietary modifications because it sounds better. All right? To promote weight loss, stress reduction, increase physical activities where appropriate. Okay, stop using the elevator and use the staircase. It doesn't take much. It's only 3 flights of stairs. It's not like you're going up 99 flights of stairs. Some of you are like, Vincent, I'll be right there. That was 1 flight. Okay? Yeah, you know who you are, you people. Drug treatments. Well, this is stuff that they would give you if need be. Okay, non-invasive. Okay, remove. Let's remove. Let's remove it or put a little stent in there to prevent it from closing. Lots of heart disease going on. Normal heart, look at that. Advanced coronary artery disease. You think that heart's getting the blood it needs? That's a big negatory, Ghost Rider. This heart's about ready to fail. Going down a path of no return. Yeah, not good. Occluded artery. Notice they're occluded on the surface of the heart. If they're occluded on the surface of the heart, we cannot supply blood to the heart. If we can't supply blood to the heart can't beat. If it can't beat, it breaks down rapidly. That means the muscle breaks down. If we do get blood back to it, it will have a nice little chunk of dead cells that will never, ever recover. Ever. If they never recover their scar tissue, that means your heart will not beat proficiently. That means you will be using the elevator. You will be taking medication. You will be walking slow and have labored breathing and difficulties with your fingers and toes. You think that I'm just saying this because I like exercising all the time? No. Let's just back up. Look at that. That's phenomenal. That's like modern art. Okay? And you know what they say about modern art? It's not appreciated until you're dead. I know, you're thinking, what? Yeah, I'm trying to scare you a little bit. Okay? Eat healthy, exercise. You don't want to be modern art. No. All right, heartbeat. Heartbeat. A single contraction of the heart. The entire heart contracts in a series. First the atria and then the ventricles. Squeeze, contract. Squeeze, contract. Okay, when I'm contracting, which valves are closed? A, B. Which valves open? Thank you. Nice. I think I'll make a song. We'll sing a song together. I've never done that before, but I've heard some students say, we sang a song today. Okay, maybe there's a song about the heart beating we could do. That would be awesome. We could sing all in unison, and anybody that has like high pitch, they could be like the chime part of it, like ding. Okay, cardiac physiology. 2 types of cardiac muscle cells: conducting cells and contractile cells. Conducting cells controls and coordinates the heartbeat. Contracting cells produce contractions to propel blood. So conducting system, we're conducting our electrical activity through the heart. Contractile, we're contracting after the electrical conduction goes through the heart. Cardiac cycle begins with the action potential at the SA node, transmits through the conducting system, produces action potentials in cardiac muscle cells. It's crazy. So, last but not least, before we take a break, because I know you guys are chomping at the bit. No, I am not calling you a horse. I'm just saying that's what they do. Just chomp at the bit. If you guys have never heard that term before, explained what it means. Horse bit in its mouth. You're like ready to go, and the horse is chomping at it to go. Chomping it. Just saying. I said carne asada yesterday, and I lost half of you, so I just want to make sure we're all on the same page. Okay? Susan's like, carne asada? What? Mexican food? Yes, please. Conducting system. Oh, that was big. Let's do this. Okay, we have our 4 chambers. Conducting system. There it is. SA node, AB node, bundle branches, Purkinje fibers. Okay, that's the conduction system. Well, it makes sense, doesn't it? How about this? Squeeze, contract. Yeah, it makes sense. It's a conduction system. It's where an electrical current flows through the heart. Okay? It's where an electrical current flows through the heart, causing squeeze, contract. Questions? 7-minute break. Seven minutes. I know, come on, 7-minute break. And this is your chance. I'm giving you 7 minutes. If you need to copy this, run, Forrest. Run. You see that? That's the lab today. Run, Forrest, if you need a copy. If you're one of those people that can write right in your book, then you're solid. You're good. You're 200%.